Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have on board as our guest Dr. Lynn Lafferty, who is a PharmD as well as a naturopath. And Dr. Lynn is a doctor of pharmacy, a licensed pharmacist, naturopathic doctor, diplomat from the American Clinical Board of Nutrition, master herbalist, and chef, who is committed to finding the safest and most effective means to promote health and wellness over disease and illness. She is an endowed professor and assistant clinical professor at the Nova Southeastern University College of Pharmacy and has functional clinical nutrition and herbal therapy practice at the Nova Southeastern University Clinic Pharmacy. Before this, she worked for many years at NSU College of Osteopathic Medicine, where she put together an integrative medicine department and created the certificate in functional nutrition and herbal therapy. Her research is focused on natural medicine and supplementation therapy and is currently conducting research on antibiotic resistance and natural immune builders, herbal considerations in the elderly population, and genomics. So she's a little bit busy. You can find her at drlynnlafferty.com. That's DrLynnLafferty.com. And we'll have a link on the archive where you can go there directly. Dr. Lynn, thank you so much for joining us today on Herbally Yours.
Thank you so much, Ellen. It's really a pleasure to be with you. I'm a big fan of all your work.
And I want to share with our listeners how, I find guests all different ways. I read their books, I read their columns, but as many of our listeners know, I'm very active in the American Holistic Nurses Association, as well as the American Cannabis Nurses Association. So I've been doing all that many years, and I am, in fact, a presenter there. But last month, I was just part of the group listening to the presentation, and it was Dr. Lynn. And Dr. Lynn, you completely blew me away because of your depth of knowledge. So let's go back in time and share with me, why did you become a pharmacist in the first place?
Well, I was always interested in chemistry, and I had my first chemistry set, I think, when I was about in second grade, and also in all of the sciences and math. So I was really interested in that from a young age. I set out to be actually a medical doctor, but I had learned from a woman who was in medical school who had become a pharmacist. She said, "Oh, get your pharmacy degree first. It's very difficult, and medical school will be much easier." And she was working full time. But then my boyfriend at the time was in medical school. He said, "You really don't want to go to medical school. The medicine is changing so much." So I stuck on the pharmacy track.
And so you became a pharmacist. But, a lot of the pharmacists, both who I interview here on Herbally Yours, my other radio shows, and who I speak to at this point in time, are really frustrated because they find what their job is standing behind a counter and basically making labels and counting pills.
Yeah, unfortunately, we've relegated ourselves to that because it wasn't quite like that when I got out of school. And, at our medical school and pharmacy school, we have a chancellor who's 85 years old, and he's still the smartest man in the building. He's so smart. And he went to Columbia University into pharmacy school back at a time when the pharmaceutical companies were just emerging. And he actually was taught how to move molecules around to create drugs on natural substances. And so he actually wanted me to come there because he felt that we were losing the old natural remedies and the vitamin therapies. We have a book called Goodman and Gilman, which was like the Bible of pharmacology. And it was copyrighted, the book I was looking at, in 1977. And there was actually 60 pages within that book on vitamin therapies that were used all the time in hospitals and in practice. And then also, Lilly Pharmaceuticals had about 300 products when I got out of school, and there were many natural things. They had natural things like liver tablets, which was actually their number one seller from cow. So they had a lot of animal products, desiccated adrenal and those types of things. They made bile salts back then, which every person that lost their gallbladder got a prescription of bile salts. And I find that's a real game changer for my patients today. They're still available. I use a company that's behind the counter. You don't need a prescription, but it only can be sold by licensed healthcare professionals like pharmacists, nurses, physicians, dentists, and chiropractors.
So you're still using some of these old-fashioned recommendations for your clients. And that's another fantastic thing, that through a mainstream university, it happens to be right here in Florida, called Nova Southeastern University, there is a clinic, and people can actually consult with you if they'd like to know what kind of natural thing they might use for their health issue. That's just amazing, because it's not, in a dark corner somewhere. It's actually at a major university.
Yeah, and even more amazing is the physicians, the medical doctors and osteopathic doctors who back me, send me patients. Our rheumatologist sends patients to me, and the family medicine sends patients all the time. They get patients who only want natural things. They don't really want the medications, or they would like to start with that. Or I have a lot of physicians who'll send me patients to help take people off from medications that they didn't learn how to do. But one of the biggest things we get are your proton pump inhibitors, because if you look at the patient insert, the package insert, the patient is only supposed to take those for 2 to 6 weeks, really, except for.
Oh, wait! I want to stop you right there, okay, Dr. Lynn, because you and I know what that means, proton pump inhibitor. But let's say we have a listener. Okay. What is a proton pump inhibitor?
Yeah,
what would
about
be a common name?
Yeah, Nexium, oral Plazolam. Omeprazole. Also, oh gosh, no.
And why would somebody be taking these?
Yeah, they take them because most people, as they age, they do have an imbalance of their digestive enzymes. But as we age, all of our digestive enzymes decrease. So what this does, it blocks the acid. Back again, when I got out of pharmacy school, there were prescription digestive enzymes. So that's what we would want to supplement with as we age, our digestive enzymes, to see if that can help us with our digestive issues.
Because that's such a premise of natural medicine. The class that I saw you teach was so amazing, because you talked about the whole vast array of, things that might be called leaky gut syndrome, and so much that is addressed in what we call functional medicine. That's completely ignored, because with the example you just gave, those pharmaceuticals are specifically designed so that you don't feel the symptom of a burning, because it decreases the acid, but it makes the digestive process less efficient, not more efficient.
Yes, and there's many side effects and many studies that show being on these drugs in a long term causes things like in more broken bones and something called C. diff, which is a very bad infection that you get in the gut, can be deadly. 14,000 people die every year. More prone to get stomach lesions, and many other things that the research is now showing. And it's one of those drugs, if you are on for a long time, it takes a little bit of time. Matter of fact, one patient, it took me 2 years. She'd been on them for 12 years, and it takes a little bit of time to get off from those. But I have many physicians that will send me patients to help them get off those, or maybe their painkillers or other medications that they would like to see them off, because it's conflicting with either them getting 100% better from their condition, or may interfere with other drugs or treatments that they're trying to do.
Well, I want to remind you that you're listening to Herbally Yours right here on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and today my guest is Dr. Lynn Lafferty, who is a pharmacist as well as a naturopathic doctor. And what is the best way for people to find you, Lynn, if they're interested beyond hearing your show today?
It would be to go to drlynnlafferty.com, and there's a contact me button, and you can call, or I prefer email. Also, if you'd like to explore making an appointment, you can call the Nova Southeastern University Clinic Pharmacy. My clinic is inside the pharmacy, and that number is 954-262-4550, and press 0.
Now, in today's world that we're both living in, there's a lot of negatives. I was just talking to our station director, Mr. Sean, and, he's been tremendously supporting at setting up an entire system so we can still bring you radio shows at this time when everything is locked down. But, everything has a flip side. Everything, is sort of positive and negative. And one of the positives of this entire time that we're in right now is that it has expanded access to health providers such as yourself and myself as well, because people are more open to doing visits virtually rather than coming. So even though you're in Florida, it kind of opens up that group of people who might want to speak with you very easily now.
Yeah, I even have patients from India and from England. So I've always had patients from all over the country, even when I had my own private practice.
So, that's the good news. It's not only if you're here. But what I love about Nova is that seems to be a rather progressive school, because I myself have taught for them, just as a visiting instructor, and I've in the Department of Nursing, not in the department you're in. And in the Department of Nursing, they're quite open to exposing their students to things like herbal medicine, which you are really an advocate of as well.
Yes, and I have a course in herbal medicine for the fourth-year medical students. It's an elective that they can take for the osteopathic school, and put 5 courses together in their nutrition department for their master's program in functional nutrition and herbal therapy. And then I put 4 courses together for the College of Pharmacy. It's so important. And these things were taught when I was in pharmacy school. So this, it was in vogue back then, fell out of vogue. And now it's really coming back into vogue, because I think more and more people are seeing the quality of their food, and what they eat really makes a huge difference in the way their body responds and how healthy their body is.
It certainly does. And one thing I want to talk about, I don't want to date the show by talking about COVID. So we'll say this can be helpful for COVID, but more expansively for immune support overall. Why does it seem like there's no discussion about anything but vaccinations, as if that's a magic bullet to not getting COVID, or let's say getting well when you have it, or any other viral infection, when we know in the literature, and I know you're a literature geek as I am, there is massive information about something very simple. Let's just say vitamin D or other things that you might recommend due to the science.
Correct. Yep, it's all in there. Early on, I'd like to just tell you a little bit about my background, because my grandmother had a 150-acre farm in upstate New York, near the Finger Lakes, Western New York. my great grandmother came from Italy back in like 1915. And my great grandmother, who went to Buffalo, actually died from the Spanish flu, while my other grandmother, who was on the farm 50 miles away, actually was taking care of people. 20 people she took care of during the Spanish flu. And she told me when I was little that no one got it, and that no one in our family got it because they had lots of elderberry trees. So what I did early on in January was I had the students go to the library. It's always good having students. You can get them to pull a lot of more literature than what you can do. And we found a really nice study that had been done on COVID SARS in a nursing home back in 2017, where they all lived and it resolved itself in about 5 days. So I went and I had elderberry made exactly the way, extracted in alcohol, the way the study was done. So early on, if people had COVID and they were looking for something natural, because at the beginning there was nothing, they were giving no drugs or anything. So I had lots of people coming to me for prevention, and also coming to me if they had got COVID. But many of there's so much literature on how much the plants have antiviral, antimicrobial, bacteria, fungus use, and how powerful they are. So it doesn't take much to figure some of this out. And like one of the professors asked me one time, why does oregano oil, let's say, have such a broad spectrum? I said, because the plant itself has to fend off bacteria, fungus, viruses. And so the chemicals, it's its own little pharmacy inside that plant, as you know. And so those chemicals translate into our body as also having similar effectiveness. Some of them have more effect than others because some plants are attacked more by, let's say, fungus or the viruses than other plants are. So it's just really fascinating to me that our Creator did not leave us hanging, that there's medicine right in front of us at all times, and people just aren't aware of it.
Yeah, but it's more than not aware. So you just named some things that I think everyone should have in their natural medicine chest. And if they even think for some reason they went out in a crowd, or they get the slightest amount of scratchy throat or whatever, because you can get that for any reason besides COVID, that you should have at home in your medicine cabinet, like you're talking about, from farm to pharmacy, your grandmother's recipes for good health, things like oil of oregano, elderberry, which is also called sambucus, that's the genus name of it. Vitamin D would be another one, and I'll throw in a bunch more like oxalococcinum and gamloling, which are Chinese herbs, so that's just getting a little bit more involved. But even just oil of oregano, elderberry, vitamin D, and vitamin C. Now,
I'd like to add one thing to that, if I could. Zinc.
Please.
I think zinc is so important because it puts it almost makes your mucous membranes, and that's the way the viruses get in. And this has been shown in colds and flu and everything, not just COVID. It makes a Teflon coating, I like to think of, so that the virus can't even get in. I've worked every day since this happened. I stood for about 3 hours within inches of a very good friend of mine who got it 2 days after that, and I never came down with it. So obviously, I don't think it entered my body. So I think, and zinc also stops the replication of the virus 5 different ways in the literature.
Zinc has been so well proven that if you go even into a regular drugstore, and as a pharmacist, it actually says it on the label, which is amazing.
Yes.
That is because it is so well proven in literature. And they know the action. But why isn't this promoted? Why doesn't everybody have this? You're talking about pennies to buy all of these things.
I know. Early on, I called the governor's office here. I just couldn't get through to anyone because I said if he would just send zinc and vitamin D to everyone, we'd have they'd save so much money. But, sometimes it's hard to get through to the people that you need to speak to.
Well, save money, save life,
save lives.
So, but how can we? I mean, I do this radio show, but why isn't this what they are saying on every television show and every radio show? It doesn't mean don't get your vaccine. It just means to have at home to support yourself. Like for all the children, for instance, I have my grandchildren on it. I have all my clients on it. And I can say within that small group, it's not that small, but say thousands, either no one has gotten it or they tested positive and within a day they're fine by using these things.
I know. It's really something. There was a man that was in the hospital and he had COVID and he thought he was getting better. And he was a young man, about 38 years old. And he thought he was getting better. And then all of a sudden his oxygen really dropped and they admitted him in the hospital. And this was up in Minnesota. And they asked him, he said, all I would like is zinc and vitamin D, and the doctor wouldn't give it. So then he had gotten so bad, they put him in the in the ICU. And they wanted to put him on a ventilator. And he said, no, I just would like some vitamin D and some zinc. And I believe that doctor also gave him vitamin C. And the next day he was like 70% better and got out of the ICU. And so these things are proven. There's hundreds of studies. I
just want to mention
they're very inexpensive. So they're going against a big marketing department of things that are more expensive, And one of the things I'll be doing on my website that you mentioned is called Becoming Your Own Health Investigator, where you will learn things about things from the farm or from your kitchen and things that you can do naturally, as well as advocacy. Like I see people who are confused when they go to a hospital and they can't talk to the doctor or something. There's something you can do, call a patient advocate right away and you get help right away. So there's all these little things that I've learned from teaching in medical schools and pharmacy schools and also, of course, working with my patients, looking at frustration. So this health investigator course I'm going to be doing, it's a 10-week course. We'll be showing recipes and looking at literature, looking at different things. And we also have a free class coming up on the immunity. So all these natural things you're talking about. And I'd love for you to be on that course if you'd be interested in joining me, because I think you have a lot of things to add because you know more herbs than I do because you've been doing this for so long. So,
well, that sounds like a good project, and I will definitely join you on it.
Great.
But I love the name of this, and this is going to be open to the public, right? You don't have to be in pharmacy school or in medical school. It's called Becoming a Health Investigator. What a good name.
Want you to learn and also learn how to look at the literature yourself. We'll be exploring literature. We'll have phone calls about if people have some problems, we can all talk about it and think through things. And, early on, I saw that eucalyptus blocked RNA viruses. And I think it also showed in one study COVID. And so we put a diffuser in our pharmacy. We didn't have the glass, early on or anything. So we were diffusing eucalyptus oil. And, none of the pharmacists got it. I only know one pharmacist that got COVID, and he's in his 70s and has had like 3 heart procedures. So he's at a really high risk, and it doesn't take care of himself very well nutritionally either. But none of us in the pharmacy has gotten it. And I really would like to do a survey of pharmacists versus the other groups of people to see what our rate was of getting COVID, because a lot of times when you're exposed to things like that, you actually don't get the disease. Your immunity builds up, kind of like getting a vaccine, right?
Right. Now, even, it has nothing to do with, you could still choose to get a vaccine.
Yes, absolutely.
It's just not wait and do nothing until such a point, or even believe that just getting a vaccine is going to be the panacea. How about building up your natural immunity? What I'm upset about, do you know, one time Dr. Fauci did mention that there are good studies on vitamin D. He actually mentioned it on television. I happened to catch it, but never again.
Right.
So
he mentioned that he was taking vitamin D, but that was in either late September or early October on a podcast with Jennifer Gardner, which I doubt very many people, I'm sure lots of people listen, but not the whole country. But he's not mentioned any of that. And there's hundreds of studies for the flu and all other sorts of RNA viruses and viruses in general about vitamin D. And, I just want to mention something because this is very interesting. Every semester, every month, I get new students that rotate through my clinic and they have to do a presentation. And I asked my students to do a presentation. She wanted to do the presentation on vitamin D. And I asked her to add the effectiveness of vitamin D in endometriosis and polycystic ovarian disease. And it's amazing the studies she pulled on that, and a huge difference with vitamin D levels with whether or not you have those conditions.
Well, first of all, I do believe that vitamin D levels should be measured normally during any physical.
Right. Absolutely.
It's not a hard thing and you can ask your physician for 25 hydroxy vitamin D level, which is just as easy to measure.
Correct.
And, here in Florida and now all across the country, Dr. Lynn, people can actually walk into any lab and just get anything they want measured. Of course, it won't be covered by health insurance, but sometimes it's not expensive. Sometimes even if they bill through health insurance and it's $100, they'll charge an individual $20 for the test, cash up front.
Exactly. I think it's $20 for a vitamin D test. So it definitely is not expensive. And it's, especially right now, it's more than worth doing.
So that is just wonderful. So I am so happy to meet you, Dr. Lynn Lafferty, PharmD, ND, all kinds of degrees. You've been studying this your whole life. I'm sure you've gotten pushback for your focus because there does seem to be a lot of political pushback against the truth. And why would people do that?
Well, we were talking about that because I said, I really admire you. You were really a trailblazer before me. But, I think we were taught certain things in pharmacy school. We were taught a lot of natural things, but then we were also taught that, you get enough vitamins from your food. You don't need to take extra, and other things. So they're getting messages and being taught more only about drug therapies today than they are anything natural.
We have to end it there, but I want to remind our listeners, we can find Dr. Lynn at drlynnlafferty.com, and we will have a live link to that on our show, because after we do the radio show, then we also post it online. And I want to thank you, our listeners, so much for tuning in once again to Herbally Yours, produced in the studios or nearby of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, send us an email at whpc@ncc.edu. This is your host, Ellen Kamai. Find me at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.